Welcome to Camp Maddie, Pet Inclusive Housing Initiative. I'm Diana Cruz, Program Director at HEART LA. That's Housing, Equity, and Advocacy Resource Team. We're based in Los Angeles, and you'll hear more about what we do a bit later on in the program.
Hi, I'm Jillian McMillian, and I'm a lived experience advocate for the homeless, a newly certified CAP behaviorist, now accepting job offers, and a proud advocate and board member for My Dog is My Home.
Our presentation is with Christine Kim, the founder of My Dog is My Home, a national nonprofit dedicated to expanding access to shelter for individuals experiencing homelessness and their companion animals. Christine will talk to us about understanding human homelessness response systems for better animal welfare, advocacy, and program design.
Hey, Christine, welcome. So glad you could be here.
Hi there. Thank you so much for having me.
Well, over the years, Christine has worn many hats, but through it all, the one hat that never came off was caring for people and their companion animals. Families, no matter what that may look like. It has been a blessing and an honor to know such an empowering and gentle soul. It is my honor to introduce you to the woman that showed me that I matter. Christine, with gratitude, I welcome you to Camp Maddie.
Thank you so much, Jillian. I have to say it is my honor to have you in my life. And I just want to thank you for everything that you have taught me. And I also want to thank Diana, of course, for the warm welcome. And thank you to Maddie's Fund and to Michelson for Found Animals for this opportunity to share with everyone some of the things that I have learned and would like to pass on. So at this point, I will share my screen. Okay, so today I will be presenting a brief 101 on 3 of the main components of the human homelessness response system. But first, I'd like to just very briefly tell you a little bit more about My Dog is My Home. So as Diana and Jillian already mentioned, My Dog is My Home is a national nonprofit that's dedicated to increasing access to shelter and housing for people experiencing homelessness with companion animals. Our work is based on the basic premises that animals are our family members, maintaining that human-animal bond is important, and that it is possible to create better systems that keep these families together through interdisciplinary collaboration. We work towards our mission in 3 main ways: storytelling, community building, and technical assistance. If you'd like to learn more about what each of these program areas means, please feel free to reach out to me. My email address is right here in this slide, and I'll be posting a PDF version of this file to Maddie's Pet Forum. But for today, for this roughly 1 hour that I get to spend with you all at Camp Maddie, I will be focusing on helping you understand some of the basic components of the homelessness response system. As many of you already know from working in animal shelters or in your other roles that you have, where you're paying attention to national intake and live release data, homelessness and housing have significant impacts on animal surrender rates. Where homelessness and housing may have previously been thought of as outside the purview of animal welfare professionals, that idea is quickly changing because we're witnessing its growing impact on the animals with whom people share their homes. However, housing and homelessness are incredibly complex topics, and the system that communities have to address homelessness can seem opaque and difficult to navigate, even for somebody like myself who has worked in homelessness and housing for my entire career and thinks about it every single day. As animal welfare professionals, you may not be privy to the ins and outs or the language or even the basics of the system, which has traditionally been in a different silo from you. And this can make it difficult to know where to begin if you want to start connecting across agencies or disciplines for collaboration. So this presentation has the overall goal of helping animal welfare professionals advocate for and support pet-inclusive solutions within the human homelessness response system by providing a basic overview of its major components. So by the end of this webinar, you will be able to define 3 major components of any community's human homelessness response system, and name at least 1 area of potential collaboration between your animal welfare organization and a housing or homeless services organization. This is the agenda for the webinar. We'll spend the first few minutes after this understanding the connection between human homelessness and animal welfare. Then we'll launch into the 3 components we'll be covering today, which are prevention and diversion, interim housing, which is also known as emergency shelter, and permanent housing. We'll then go over a few fictional case studies and key takeaways, and then we'll close with Q&A. Now for a quick poll, because it's always good for me to know where the group is generally starting in your knowledge journey on this particular topic. An interactive poll was just launched, so please take a moment to answer the question on your screen. And the question is, what is your knowledge of the human homelessness response system in your community? None or minimal, that system is a mystery to me. I know of the basic components of the system, but by name only. I have a fair grasp on the system and in communication with homeless services providers or government agencies occasionally. I have a fair grasp on the system and I'm in communication with homeless services providers and government agencies regularly. Or I fancy myself an expert and I'm seen as a part of their continuum. So just one more moment before that poll closes. It looks like quite a few of you are in that beginning and middle part of the spectrum here. So you believe knowledge of the homeless services system is important, but you're not quite integrated into the system or have strong relationships yet. And it looks like quite a few of you actually have very, very basic or minimal understanding of the homeless services response system, which of course makes it great that you are all here today. And I'm excited about this. So let's start with the state of homelessness in the United States right now. According to a report that was released by the National Alliance to End Homelessness, a record high of more than 653,000 people experienced homelessness on a single night in January. More people than ever are experiencing homelessness for the first time, and severe housing cost burden is on the rise, which means that more and more people are spending more than 30% of their income on rent. So what does this information on human homelessness have to do with animal welfare? This slide divides the relationship between human homelessness and animal welfare into 2 very simple categories. The first set of bullets are about the impact on animal shelters, and the second set of bullets are about the human-animal bond. So as you all are already aware, the impact of housing insecurity reaches animal shelters. Housing issues ranks among the top in the list of the primary reasons people surrender their pets to shelters. So for example, a sudden eviction or inability to find affordable pet-inclusive housing, or an inability to find pet-inclusive interim housing can lead families to surrender their animals that they love simply because they have no other option. This cycle increases intake at shelters, putting more stress on the already limited resources of animal welfare organizations. And animal shelters not only have to manage the rising intake rates, but also the emotional toll of handling surrendered animals whose families didn't want to part with them in the first place. Of course, the impact on the individual families and their animals are also a reason to care about this intersection. Studies show that between 5.5 and 23% of people experiencing homelessness have animals. So these are studies about people who are actively experiencing homelessness at the time of the study. So that's the 653,000 plus number. It's 5.5 to 23% of the 653,000 plus, right? What we know even less about is the number of people across the housing insecurity spectrum who have animals. So I hypothesize that if you take into account people who are not actively experiencing homelessness, but imminently facing housing insecurity or homelessness, those people who are at risk of homelessness, that percentage is actually much higher. There are also studies that show that people experiencing homelessness with animals have higher attachment rates to their animals. And that makes it particularly difficult for people to separate from their animals. However, as we also know that for people across the board, animals aren't just pets. They're increasingly understood to be members of the family, providing that essential companionship, mental health benefits, and stability during difficult times. Despite these benefits, animal companionship complicates access to services that can prevent and end homelessness for people and families. Most housing options within the homeless services system don't accommodate animals, forcing people to choose between a roof over their head and the companionship of their animal. And when they're faced with this decision, many ultimately stay on the streets to keep their animals. For people who do choose to separate from their animals, even temporarily, it can cause tremendous grief. And that can be true on both sides. So people need their animals, and of course, animals need their people. In short, human homelessness and animal welfare are connected. Addressing these issues together creates more compassionate, stable communities and keeps beloved animals where they belong, which is with their people. A healthier overall safety net is one that is made up of a wide variety of services that address person, animal, and environment. And in this case, the person, their animal, and their literal home or their lack of a home. And when one does poorly or fares well, so do the others. Ideally, all of these different systems would be working in tandem to progress together. It can be difficult to know where to begin or jump in because all of these systems are quite complex in and of themselves, and our professions have been fairly siloed from each other. So from here, I will hopefully help you feel more confident in your ability to strategize and reach out to your homeless services response systems, because after this, you'll have some basic knowledge of the components that make up your homelessness response system. And you'll be pleased to find out that the components of the homelessness response system are probably easier to understand and pick up than you might realize, because there are actually quite a few similarities between human homelessness and animal homelessness response systems. The components of the homelessness response system may vary a little by community, but this is a simplified 101 that's designed to be useful to you wherever you may be joining us from across the country. And again, if there are more nuances in your community that you'd like to talk through that we don't get to today, please do feel free to reach out to My Dog is My Home. The first component that I'll cover is prevention and diversion. So I'm sure just by the heading of this slide, you can guess what this component of the system is about. In animal shelters, very similar words or even the same words are used to reduce admissions. The same principles apply here, and I think many of you will actually be shocked at how the human homelessness world and the animal homelessness world have come to develop similar methods for ending homelessness in their respective fields. Prevention and diversion are important components of a community's homelessness response and can help reduce the size of its homeless population. What is prevention? Prevention assistance can help households in preserving their current housing situation, stopping them from losing their homes in the first place. Homelessness prevention activities and services generally consist of financial support and legal support, including, but this is not an exhaustive list, it includes short-term and medium-term rental assistance, payment of rental arrears, security deposits, advance payment of last month's rent, and then it also includes legal services like mediation, eviction prevention, among other things. In the homeless services sector nationally right now, there are limited homelessness prevention resources. That's really frustrating because, as we all know, across these fields, it would be ideal if we could just stop both people and animals from becoming homeless in the first place. Let's just keep them in their homes instead of pouring all of these resources into an elaborate response system. Unfortunately, this is the reality of the constraints of the system that we have and that we're working within. If you feel that prevention, despite its limitations, is the place that would make the most sense for your organization to align strategically, the organizations and entities that are likely doing homelessness prevention work in your communities are entities like your eviction prevention folks, like your legal aid societies. Sometimes your county or city will directly have homelessness prevention programs. And sometimes they spread the work out to the network or nonprofit organizations and service providers in your area. So the best thing to do really is simply just to Google homelessness prevention and then the name of your community and see what comes up. So down diversion. Diversion is an intervention designed to immediately address the needs of someone who has just lost their housing and become homeless. The goal of diversion is to help the person or household find safe alternative housing immediately rather than entering shelter or experiencing unsheltered homelessness. It's intended to ensure that the homelessness experience is as brief as possible to prevent unsheltered homelessness and to avert stays in shelter. So I'm sure that sounds very familiar to all of you. Just like animal shelters, no matter how nice they are, the preferred option for the health and safety of the user is to go somewhere other than a shelter. Shelters can be traumatic, unhealthy, unsafe, again, no matter how nice they are. Some data show that people who enter shelter experience longer periods of homelessness than those who are diverted from it. No matter how well run a shelter is, clients prefer to be in housing, and housing is more likely to improve their well-being. Likewise, being unsheltered has high risk of negative health outcomes and involvement with the criminal justice system, like being ticketed or fined for sleeping on the streets. Diversion stems the inflow into shelter. So every person diverted makes a shelter bed available for someone else who needs it. It is considerably less costly on average than a shelter stay. Diversion avoids the emergency-related cost of unsheltered homelessness, including ambulance use, sanitation, and also, of course, interaction with law enforcement. The idea is to immediately get the client into a safe housing alternative, which may be short or long-term. Some of these options may include, but again, not an exhaustive list. Some of the options may include a negotiated return to their previous housing, short-term non-shelter accommodation, apartments or homes, including shared housing, or returns to family. So please feel free to throw in the chat any ideas you might have about who would be doing diversion work in your community. The short answer, the cheat version, the short answer is that anyone can do diversion work at any point, upstream or downstream. But concrete examples are those folks who are at the front door of the homelessness system, right as someone has lost their home and they reach out for help. So, for example, the workers at the American Red Cross responding to an apartment fire is actually a great example of someone who might be doing diversion work. The 211 or United Way operator who works the community hotline and provides referrals to community resources, they're also doing diversion work, hopefully. A less obvious person who can contribute to diversion work would be the admissions counselor at the animal shelter. My Dog is My Home actually recently provided training for a large municipal animal shelter, and we trained the staff to pick up on cues and keywords about human homelessness. So while the animal shelter staff are not expected to case manage human homelessness in great detail, they did get training on the resources that are available and appropriate referrals for the different cues they pick up on about a certain person's situation. All right, so next slide, interim housing, also known as emergency housing. A quick note about the semantics here. So the way that I'm using the term as emergency shelter and interim housing are interchangeable. There may be some differences by community, but guidance from some of the leading homelessness organizations and advocates are pushing for a shift in language. So long story short, the term emergency shelter can be stigmatizing. So it's starting to get swapped out for the term interim housing. The term interim housing is the umbrella term, which refers to a full range of shorter-term crisis options for temporary accommodations that may currently be referred to by a variety of terms that you may hear of in your communities, like congregate or non-congregate emergency shelter, navigation center, bridge housing, transitional housing, or other terms. The term interim housing, again, is that big umbrella term for anything that's short-term kind of crisis. It's not meant to imply that people who are staying in interim housing have ended their homelessness. People in interim housing programs or any type are still experiencing homelessness. People experiencing a housing crisis, or if they're fleeing an unsafe situation, need to find a place to stay quickly. Unfortunately, prevention and diversion efforts either don't happen or they don't work every time. So interim housing or emergency shelter can fill this role in a crisis response system. The best practice in homeless services is to make these interventions low barrier. This means that interim housing can and should be accessed immediately and easily. To do this, barriers to interim housing, such as sobriety requirements, income requirements, and other rules and policies that make it difficult or undesirable for people to access the shelter, like the No Pets Allowed rule, need to be eliminated. Our top experts in homeless services and advocacy know that low barrier interim housing and allowing pets through the doors is best practice. Unfortunately, not every community has made that transition to the low barrier model, or not all of them have been including the removal of the no pets rule in the way they operationalize low barrier practices. Operationalizing low barrier practices can be really hard for homeless services agency. So if your animal welfare organization reaches out to offer support, you should know that you are a value add, right? You are offering a resource to these interim housing providers that will be allowing them to follow best practices in their own field. Again, you're a value add and they should look at you that way, although I think sometimes at first they will not see you that way. This is probably one of the most visible and well-known or well-understood parts of the homelessness response system. So you may already know who the providers of interim housing are in your area. If you feel that this is the place where your animal welfare organization would best put its resources to support keeping people and animals together, you can talk to the individual providers on the organizational level, or you can try to approach it from a higher level, like from a government level or a continuum of care level, where you'd be talking to the body that has either coordination or oversight authority over the individual providers. It depends on your resources and where you feel they would be best applied. A homelessness response system must also have the capacity to connect people experiencing homelessness with permanent housing programs. Two that I'm certain you will hear about in your communities are rapid rehousing and permanent supportive housing. Rapid rehousing is known to be a primary solution for ending homelessness. The key words here are rapid and time limited. The way it works is by providing short-term rental assistance and services so that people can obtain housing, again, rapidly, increase self-sufficiency, and stay housed. It's offered without preconditions such as employment, income, absence of a criminal record, etc. And the resources and services provided are typically tailored to the needs of the person. Research also demonstrates that those who receive rapid rehousing are homeless for shorter periods of time than those who are assisted with interim housing. Permanent supportive housing is an intervention that combines affordable housing assistance with support services to address the needs of people who experience chronic homelessness. And those are those folks who have been homeless for a year or more, or who have been homeless repeatedly within a short period of time. These are very often your community members who are frequent users of emergency systems like emergency rooms and inpatient treatment. So if you think about the people in your community who have been outside and visibly homeless for a very long time, permanent supportive housing is the effective intervention for them. Traditionally, the thinking was that these folks needed mental health treatment, drug treatment, they needed to prove that they were sober, et cetera, in order to be given access to a tiered system of services where they had to essentially work their way out of homelessness by proving XYZ, proving that they were housing ready. And what research is showing us is that this step ladder system is not the main approach that we should be using. What we should be doing is housing people first, then supporting them in reaching their other health and mental health goals and other goals, because it's hard to work on those things when you don't have a place to live. But of course, in both of these solutions and others that involve permanent housing, there needs to be a stock of affordable housing to begin with. You can't rapidly rehouse somebody if there's no affordable housing to put them in. And right now, nationwide, there's a severe shortage of affordable housing. So you may want to think about that as well. Does your animal welfare organization want to have a place in advocating for more affordable housing? Pet inclusive affordable housing, yes, of course, that is a given, but also just more affordable housing, period, because you can't have pet inclusive affordable housing without the affordable housing. So here are a few fictional case studies to help demonstrate what partnership might look like between all of these different entities and with the different components of the homelessness response system. And once you have this initial exposure to what the possibilities can be, you can then think about where your resources are best allocated. So here's a simple case study for prevention and diversion. You have started a conversation with a large homeless services provider in your community about potential partnership opportunities. The homeless services provider immediately suggests that your animal welfare organization provide temporary boarding or foster care for people who need to enter their shelters, none of which accept pets. You are located in a dense urban area with low vacancy rates and a shortage of affordable housing, making the average shelter stay for people experiencing homelessness in your city almost a year long. Your nonprofit is eager to be supportive, but you consistently have limited shelter space and fosters, and holding or temporarily placing owned animals for almost a year seems untenable. Instead, you suggest that your organization can be a resource for the human homeless services providers' diversion efforts. You can provide supplies, behavior support, veterinary care, and on a limited basis, short-term boarding for clients going back to their housing situation, a short-term non-shelter accommodation, rapid rehousing, or other types of housing outside of shelter. So I would love for you to take to the chat and sort of process this case study. Are there similar experiences that you have had? If you were to place your own organization in the shoes of this case study, how would you handle it? Would love to know your thoughts. All right, so please utilize that chat. And in the meantime, I'm going to move on to another case study that explores what partnership and collaboration could look like theoretically, using the interim housing component of the homeless services system. You work at your municipal animal sheltering and animal control agency. You read in the news that your city has passed an ordinance that bans homeless encampments, making the city's enforcement and encampment sweep activities stronger and more frequent. Companion animals live alongside humans in these encampment communities. In the past, animal control has been involved in encampment sweeps only after decisions have already been made about the nature of the sweep between sanitation, law enforcement, and homeless services agencies. This is a strain on your limited field officers' schedules and the animal shelter. Knowing this will be happening with more frequency, you ask for your agency to have a more prominent seat at the table when there are encampment removal discussions. Due to pushback from local homeless advocates, the city commits to lowering barriers to interim housing rather than simply sweeping away encampments, expecting people to access shelters that are unappealing to use. Not least of which is because there is a no pets allowed rule instituted at all city-run shelters. Through your deepening relationships with other city agencies involved in encampment sweeps, you are able to put pressure on the city to remove the no pets allowed rule as a part of their efforts to lower barriers to interim housing. To encourage the transition, you offer your agency support and resources in creating and implementing a pet-inclusive shelter policy. So again, please feel free to use that chat. I would love to see activity in the chat as you process this case study. Do you have similar experiences? What would you do? What would those conversations be like if you were in the shoes of this fictional nonprofit in this case study here? And as I'm sure some of you are aware, especially those folks who are in the state of California, encampment sweeps and the criminalization of homelessness is very palpable. It's very real. So this is not an unlikely situation that you would be facing if you work for an animal control agency. Okay, so in the meantime, as you process this, I will be moving on to the next case study about permanent housing. Your community has pet-inclusive interim housing, thanks to your organization's advocacy and support. However, you haven't seen the use of your crisis boarding program go down. In fact, you notice that there are several people who utilize the crisis boarding program from their pet-inclusive shelter you are partnered with. After talking with the clients and human homelessness services staff you work with, you find that clients in interim housing are using your crisis boarding program most when they are attempting to transition out of the pet-inclusive interim housing and into permanent housing. Even though the interim housing facility is pet-inclusive, there is a shortage of pet-inclusive permanent housing options as a next step. Clients are attempting to keep their animals with them by requesting a reasonable accommodation for an emotional support animal. The reasonable accommodation process is clunky. Providers make the process cumbersome by asking for specific documentation, and they are sometimes unaware of their obligations under fair housing laws to accommodate emotional support animals, resulting in unlawful denials of these requests for reasonable accommodation. In the meantime, the animals end up in your care through the crisis boarding program. You'll also learn that there is a pipeline that many of the clients of the interim housing facility enter, routing them to affordable housing developments that are owned and operated by a handful of developers and nonprofits. You target your outreach to the entities that operate these affordable housing developments, using the tools you learned today from Michelson Found Animals Pi High team, and offering them the same resources that you have offered to the interim housing facility to support the implementation of a pet-inclusive policy. So again, please take to the chat. Please process this case study there. Have you had similar interactions, similar experiences? What would you do in the shoes of this fictional nonprofit in this case study? Would love to know. All right, and as you process that, I'm going to go ahead and move over to the next slide. So circling back to the goals and objectives of this webinar, my hope is that by the end of this session, you will all be able to, 1, define 3 major components of any community's homelessness response system, and 2, name at least one area of potential collaboration between your animal welfare organization and a housing or homelessness organization. This slide is a little cheat sheet for you all. So the 3 components of the homelessness response system that I reviewed with you today are 1, prevention and diversion, 2, interim housing, also known as emergency shelter, and 3, permanent housing. Prevention preserves the current housing situation with activities and services generally consisting of financial support to pay rent, arrears, and other housing-related costs, mediation, and legal services. And again, that's a non-exhaustive list there. Diversion helps a person or household who has just lost their home find safe alternative housing immediately, ensuring that the homelessness experience is as brief as possible to prevent unsheltered homelessness and to avert stays in shelter. Some of these options may include a negotiated return to their previous housing, short-term non-shelter accommodation, apartments or homes, including shared housing, or returns to family. For the folks who do need to go to interim housing, the best practice in interim housing is to make it immediately and easily accessible. Low barrier shelters should eliminate barriers such as sobriety requirements, income requirements, and the no pets rule. And again, here you are a value add if you reach out to your homeless services provider, your shelter provider in the area. You say you want to be of assistance to help them lower that no pets allowed barrier. You are helping them follow best practice or implement best practices. And as the last key takeaway, homelessness is a housing problem. A homelessness response system must have the capacity to connect people experiencing homelessness with permanent housing programs, such as rapid rehousing and permanent supportive housing and other stable housing options. So I know that was a lot of information that I just shared with you over what is a short amount of time, but please know that My Dog is My Home is available to you if you need to talk things through. There are also other great resources out there as well that can help you continue learning about the homeless services system, and this slide just names a few of them. So the Keeping People and Pets Together Toolkit by the National Alliance to End Homelessness is wonderful. It's a free resource that you can find online. If you go to the National Alliance to End Homelessness website, which is endhomelessness.org, and you search for the toolkit, I believe it's just /pets after their website URL. It'll take you to this downloadable toolkit. And this is great for sharing with your partners or potential partners in homeless services, your government agencies that are a bit resistant to the idea of integrating animal welfare into their work. The National Alliance to End Homelessness is a well-known, well-respected entity that puts out and pushes best practices. And just the very fact that they have put out this toolkit with the assistance of My Dog is My Home gives our issue great validity. So if you pass this toolkit along to those providers that are showing a little bit of resistance, hopefully that will help for them to know that it is a serious discussion, also endorsed by the National Alliance to End Homelessness. My Dog is My Home has several publications available on our website. So the link here will take you to our website where you can look at various reports. And they're, for the most part, open access. If you have trouble accessing any of them, feel free to reach out to us and we can work something out. Maddie's University has all of our co-sheltering conference recordings from years 2021 through 2023. We thank Maddie's Fund for being an underwriter of our co-sheltering conference. If you'd like to access all 3 years, previous 3 years of the conference recordings, please go to Maddie's University and search for those. Those are available to you at no cost. And then the My Dog is My Home conference is coming up very soon. This will be our 5th annual conference, and it gets better every year. We encourage you to register. Early bird registration is open now through the end of the year. And so you can click this hyperlink. It'll take you right to the website where you can sign up. Scholarships are also available thanks to Maddie's. And if you just want to put the dates on your calendar, the conference will be taking place virtually March 25th through the 27th of next year. So again, want to highlight that it's a virtual conference. It does not require travel, and hopefully that that helps. We know that everyone is so busy, working in animal shelters, homeless shelters. So this keeps it sort of low barrier for us, and that you can access the conference from your desk or wherever you would normally be working. Okay, and so for our last poll, which component of your community's homelessness response system would you like to explore for partnership and collaboration? Prevention and diversion, interim housing, otherwise known as emergency shelter, permanent housing, or maybe something else? And if it's something else, I'd love to know what that something else is. So please take a moment to respond to this closing poll question. Which component of your community's homelessness response system would you like to explore for partnership and collaboration? Again, prevention and diversion, interim housing or emergency shelter, or permanent housing. Oh, this is not what I was expecting, actually. This is great. Prevention and diversion seems like the big winner. I'm fascinated. And you know what? Even if you had if you answered something other than something else, please share in the chat why you chose the answer that you did. Why would you like for your animal welfare organization to partner with your homeless services response system on prevention and diversion versus permanent housing versus interim housing? Would love to know. So thank you everyone for participating in that poll. It's fantastic to see the results. So this is the end of the presentation. Please feel free to reach out to My Dog is My Home if you need someone to bounce ideas off of for your next steps. We are here and available for you. And I'd like to thank you all for joining me to learn about the homelessness response system. Of course, as always, thank you to Maddie's Fund for having me, and thank you to Michelson Found Animals for their partnership and support as well. So now I will take questions.
Thank you so much, Christine. I always learn so much from you every presentation. Well, we only have about like 15 minutes or so for questions with you, so let's dive right in. Let's see. I see one here. This is from Candace. Candace says, hello, I have a question and a story. I was wondering if you know of an organization that will assist in acquiring a psychiatric service dog. I lost my best friend Marty in July. He was my only source of support, and I'm lost without him. Also, I'd like to suggest that homeless shelters need to be monitored and audited on an ongoing basis, depending on if the staff likes animals or not. I've seen some be turned away because they did not want the pet there.
Yeah, well, thank you for your question, Candace. I don't know of an organization off the top of my head, but I think we can assist with maybe doing a little bit of research with you. So if you drop your email in the chat, I can go ahead and grab that, and someone from our team will be in touch with you about that particular part of your question. And I do just want to share my condolences and say I'm sorry about your loss of Marty in July. I'm sure that was very difficult, and I just want you to know that my thoughts are with you. About the other part of your question, suggesting that homeless shelters need to be monitored and audited, and that there are kind of individual differences. It sounds like you have some experience or have witnessed the kind of personal discretion that gets exercised based on the individual staff member and whether or not they like animals. And I agree with you on that. I think part of the problem is that there isn't like a standard operating procedure in place when it comes to accepting animals in certain places. So even if there is a pets welcome policy, or in more likely if it's sort of agnostic about pets, it's left up to the individual person who is monitoring intake that day on whether or not somebody can come in with their animal, and it really shouldn't be that way. We should be pushing towards pet inclusive policies with a set of standard operating procedures for all staff.
I saw one in the chat that resonated with me because we this is part of our work too. I think the question was from Karen, and it's, how about when the providers available to the clients have policies forbidding writing of ESA letters? I think this was the question.
Ooh, okay. I feel like this will be better addressed in some of the following presentations today. And I think that's Heart LA's area of expertise. But I can tell you that ESA letter can come from a variety of places. So it is not limited to a medical doctor or a licensed clinician or a licensed mental health provider. There are lots of different types of providers or people that can write that letter. I think where we encounter some problems is that sometimes the letter can get pushback depending on, actually, the letter can get pushback no matter where it comes from, even if it does come from a licensed mental health provider or medical provider. But I would say in terms of what is allowable by law, the most ironclad way to go is to have it come from the medical provider or a mental health provider. But the umbrella of people who can write that letter varies widely. So it can actually come from a peer support specialist, a case manager, a non-licensed social worker, basically any reliable third party that has knowledge of the person's disability and the fact that they have an emotional support animal that's going to help them use and enjoy the dwelling, which does include emergency shelters. I don't know if that fully answers your question, but I do think it'll be touched on in greater detail in one of the upcoming presentations.
That's right. I see one from Anonymous. I'm working with homeless shelters to try to get them to be pet inclusive. The number one reason they don't do it is lack of funds. Lack of space is also there. How can they get more funding other than fundraising and donations, money from the county or government?
Right, the funding question. This is very interesting. This is something that My Dog is My Home is looking at more closely, but we're not convinced that it costs that much to include animals in an emergency shelter setting. And what emergency shelters really need at the end of the day is a will to actually implement a pet inclusive policy. If it is money for training, if it is money to have like an emergency veterinary fund or something like that, There are some limited resources available for things like this. And I would say the name of the game is partnership, right? And so those animal welfare partnerships with organizations like yours are really key in helping offset some of the costs for the homeless service, what they perceive will be costs for the homeless services organizations. But at the end of the day, it's really a will to do it. And the supplies that they think that they're going to be spending X amount of dollars on. I mean, sometimes it's as simple as putting a collapsible crate at the foot of the bed, right? And it always helps to say that there are organizations, large organizations that shelter and house hundreds of people in the same room every night that are co-sheltering, co-housing people and pets together. And they're doing it on a shoestring budget. Like, it's not adding significant costs to their budget. And if they would like to talk through what those examples are and those models are, My Dog is My Home has great programs that can funnel them to even visit some of these locations where they can learn about how it's being done.
Thank you for that. Ooh, I saw another good one. This is from Amanda. How do you combat or shift the mantra of if they can't afford the pet, they shouldn't have it?
Yeah, My Dog is My Home spends a lot of time doing this. And it's become so much a part of our operation that, like, our baseline premise is that, like, people love their animals, and it doesn't really matter kind of how much they're making every year or whether or not they actually have a physical home. That has no bearing on how devoted they can be and what the quality of caregiving that they can provide. So in order to combat that line of thinking, we simply lean on story. We lean on the personal experiences of people. And if they spend 5 minutes talking to somebody who has experienced housing insecurity, that has an animal, I think the love and devotion comes through quite readily and obviously. And also, I think it's important to combat this narrative that there is like an us and them, right? That, like, people experiencing homelessness or facing housing insecurity is some other class of people. Like, I think many of us in this room, right now, in this Zoom room, actually spend more than 30% of our income on rent. I think that affects all of us. And I think that at any point, there are a number of us in this field, in both homelessness and housing and animal welfare, that are just a couple paychecks away from being homeless ourselves. And so it's not about those people who, are experiencing homelessness that have pets that shouldn't be allowed to have their pets. Like, it's actually about all of us, and it's a growing epidemic.
This next one is from Ken. How often can the well-being of an animal be compromised in certain instances when trying to keep pets and people together, and how is that best assessed?
That's an interesting question. I mean, how often, I wouldn't be able to address that particular piece of it. I mean, I can't really come up with a exact number, right? But or level of frequency. But I think there's a piece of this that is about, like, our own internal biases and what standard of care we expect people to be giving animals. I think the general rule of thumb across the board, no matter what population you're working with, is that you do your utmost to support people in caring for their animals in their own homes or in the relationships that they have, rather than removing them. And then you provide the support in order to do that. So it takes on more of a case management assessment and approach. So getting to the bottom of I would say, first of all, there needs to be a reflection piece on your own biases, right? And then once you've done that, or simultaneously as you do that, I think sort of talking with the person and getting to the root of what you perceive to be the problematic area of care, and what is the actual root cause of that. I think very rarely it's an intentional or willful neglect or abuse issue, right? It's usually a matter of resources. And if you can provide the resource to help support that relationship, then that would be best.
Maya has a question. How can I convince my shelter that the cost of boarding a pet for 2 to 4 weeks is worth it to keep the pet with the unhoused owner?
That's a really good question. And it's a hard one. Sorry, Jillian?
Can I chime in on that one?
Oh, sure.
I think the provider needs to understand that in the long term, it's going to cause some traumatic damage to the individual and their animal. And that can become a lifelong painful situation that that person and that pet may never recover from. And with that being said, that will eventually cause that person to go further into debt to keep trying to stay on the streets with them, and then try to find a vet, or all the vet bills that'll come up, all the psychiatrist visits. And I think if they are a people-oriented shelter, that would be the most best beneficial thing for them to do. And they can also end up with lawsuits. I mean, things can definitely turn awry, and that's my side of it anyway, is the trauma that will be involved.
Yeah. Thank you, Jillian. I think those are really great points. But I think your shelter manager brings up a really good question here, actually. Because I think the instinct when you start talking about partnering with homeless services, the instinct is to go for like a crisis boarding program, or to separate, to keep the family together legally, but to separate the animals and the animals go with the animal people, and the people go with the people, right? When I think the resources would actually be much better spent keeping the person and the animal together in an interim housing facility or in co-housing. And so if there is an opportunity, like, I think crisis boarding is a wonderful resource and it should exist. And in the absence of anything else, that is a lifeline for so many people who have animals that are facing short-term housing crisis. But I would encourage you to push back on the system and on your own thinking in automatically kind of going to, animals are separated from people. Can we create a system where they are kept together in human homeless services facilities? I think that would be much better. It is cheaper for everyone, actually. So that would be the best best application, I think, of the resources, if that's possible.
Have you looked at the Community Solutions Built for Zero model to determine if that group would be a good place to offer training?
Oh, yes, Built for Zero. That's a wonderful model, wonderful philosophy. And I think that that would be a great place to begin kind of exploring partnerships and training.
Excellent. Well, that's all the time we have for questions, but Christine will be on Maddie's Pet Forum to answer any we didn't get to and any new questions you might have for her. Thank you so much, Christine.
Thank you so much for having me. It was wonderful to be here, and I hope to hear from all of you shortly.
Yeah.